Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. As of today, face masks are no longer required in many indoor settings in Ontario. However, we know that COVID is not over and that many families will be returning from March break, and we are likely to see an increase in COVID transmission. As a result, while many Ontarians will remove their masks, many Ontarians will continue to wear masks to protect themselves and others. Masks are still required on public transit and in hospitals, in long-term care facilities, congregate settings, and in medical clinics, including our vaccination clinics. Masks are still required for anyone who has returned from international travel and any close contacts of someone who is positive with the virus who may want to be out in public or attending school, which they are now allowed to do. Even for those who are excited not to have to wear masks, I encourage you to wear one, and I strongly encourage you to consider wearing one in the 3 Cs: a confined or crowded space, when you're in close contact with someone, that is, you're unable to maintain 2-meter distance, or in an area with poor ventilation. Please keep a mask with you in your pocket so you can use it when needed, especially around those who are at high risk for severe outcomes of the virus, or even just if anyone is uncomfortable with you being maskless. We are happy to be opening our community to support the local economy and to focus on everyone's mental health. But please remember to be considerate of others who may take time to embrace this change and feel more comfortable continuing to wear a mask. We continue to see stable levels of hospitalization for COVID-19 in our healthcare facilities with very slow declines. Unfortunately, our wastewater signal for COVID-19 has shown a steady increase, consistent with what's happening across the province. Last week, the Ontario Science Table released modeling data that indicated that we can expect increased transmission and increased hospitalization in the weeks to come. We will continue to watch these metrics as restrictions and mask mandates are removed in Ontario and report these trends to you. You can still check our COVID-19 dashboard regularly for a snapshot of the current situation and charts showing where we have been. There are still things you can do to prevent transmission in the community. If you feel any COVID-19-like symptoms, take a rapid antigen test if you have access to one. And more importantly, stay home to protect your loved ones, classmates, and the community you call home. You can visit york.ca/COVID-19 positive for next steps and more information. I can't stress enough the importance of the COVID-19 vaccine. Now more than ever, everyone who is eligible must get their booster dose, or younger age brackets their second dose, as soon as they can. With the removal of masks and other restrictions, the vaccine is our only protection against the virus. Ontario data shows that the booster is necessary and has a 95% effectiveness against severe outcomes or hospitalization. We are now at over 50% third dose coverage in 30-year-olds and approaching this even in 20 to 29-year-olds. Of course, thankfully, we are over 80% third dose coverage in some of our older age groups. Please help us reach our goals and protect yourself and your community. Go to york.ca/COVID-19 vaccine to find a clinic near you. For children under 12, now is the time to get your first or second dose. As screening, masking, and cohorts in schools are removed right after March break, it is critical that every child have the protection afforded by the vaccine. Get vaccinated, please continue to remain vigilant, and be kind to others as we enter this new phase.